Ever walked into the GP surgery and felt completely invisible? You pour out your symptoms, your anxieties, your worries, and all you get back is a silent nod, a quick once-over, and a prescription scrawled so illegibly you wonder if they're fluent in hieroglyphics. You leave feeling like the real conversation never even happened. Sound familiar? Now this isn't your fault, but today we're going to arm you with a tool more potent than any pill: the power of asking the right questions. I'll walk you through the 5 crucial questions you absolutely must put to your doctor. This isn't just small talk, it's a strategy to make the healthcare system work for you, not against you. We aren't learning how to argue with medical professionals, we're learning how to become their very best partners. After this video, you'll walk into your consultation not with dread, but with confidence, knowing how to squeeze the maximum benefit out of every minute. Stay with me, and I'll show you how to turn a rushed 10-minute slot into a genuine consultation that could safeguard your health. But first, jot down in the comments, what's the oddest or most confusing thing a doctor has ever told you? Before we get to the questions themselves, let's address the elephant in the room. Why is communication between a doctor and patient so often like 2 ships passing in the night? It's a messy mix of psychology, the structure of our healthcare, and the cultural expectations we've grown up with. On the doctor's side, they've got a queue out the door, mountains of paperwork, and a huge roster of patients they need to get through during their shift. The standard appointment slot, often just 10 or 15 minutes, turns the surgery into a conveyor belt. They're forced to work quickly, often using templates, giving a rapid diagnosis, and prescribing standard treatment. Frankly, they simply don't have the physical time for lengthy explanations. Then there's us, the patient. We are often intimidated by that white coat authority. We were raised to believe that the doctor's word is gospel, the final word on everything. We worry about sounding daft by asking simple questions. We fear taking up their precious time. Or sometimes we're just too scared to hear bad news. This fear often paralyzes us, forcing us to nod politely even when we haven't understood a single thing. The result is a broken telephone situation. The doctor thinks they've explained everything clearly, and the patient thinks they've grasped it all. But in reality, there's a chasm between them. Our 5 questions are the bridge across that chasm. They're not aggressive, and they certainly don't imply mistrust. They are simply a structured, polite, and effective way to establish proper communication and become an active participant in your treatment, rather than just a passive recipient. Now then, here is the first, crucial question that absolutely sets the stage for everything that follows. Once the doctor has listened to your concerns, completed the examination, and given their initial findings, you must ask, clearly and calmly, what is my precise diagnosis, and what exactly does that mean in plain English? Let's pick that phrase apart, word for word, because there truly isn't a single redundant element in it. We start with the first part. What is my precise diagnosis? Why is this so vital? Because without a precise diagnosis, any treatment you receive is simply a shot in the dark. Often, in a rush, a doctor might use vague general statements. You have a bit of a stomach issue, or it's just nerves, or perhaps it seems to be a viral thing. These kinds of answers leave you completely uncertain. They prevent you from doing your own research into your condition. They won't help a second doctor if you seek another opinion. And critically, they don't guarantee that the prescribed treatment is actually addressing the root cause of your difficulties. By insisting on a precise diagnosis, you are asking the clinician to formulate a formal medical conclusion that aligns with the International Classification of Diseases. This isn't just a catchy phrase, it is a formal code, the official definition of your state of health. Think of it like receiving a precise postcode, rather than just an anecdote about a little house somewhere behind the woods. Having that precise diagnosis noted in your medical records is your absolute right and the bedrock of all subsequent care. It is the starting point from which you can move forward. Without it, you are simply fumbling around in the fog. Therefore, please don't be shy about insisting on specifics. If the doctor seems to be prevaricating, You can politely ask again, "Doctor, I fully appreciate that the full picture might not yet be crystal clear, but what working or provisional diagnosis can we record right now?" This is your first crucial step towards taking control of your health situation. It is a fundamental requirement that transforms your general complaints into a proper, actionable medical fact. Let's move on to the second, equally vital part of that initial question. And what does that actually mean in plain English? This is where the real communication magic happens. This simple phrase is your key to clarity. It instantly shifts the conversation away from formal medical jargon, full of daunting words like essential hypertension, degenerative dystrophic changes, or chronic gastroduodenitis, and translates it into simple human language. Why is this crucial? Because fear stems from the unknown. When you don't fully understand what is happening to your body, your mind naturally paints the worst-case scenarios. A complex medical term, which is routine for the doctor, can sound like a death sentence to you. Asking for an explanation in simple terms isn't admitting ignorance. It's a demonstration of responsibility. You want to understand the situation so you can take the correct action. A good doctor will always find a way to explain complex issues using simple analogies. For instance, instead of saying left ventricular hypertrophy, they might say, "Imagine your heart is a pump. Because of the high blood pressure, it has to work much harder, like an athlete lifting a heavy barbell. This constant strain has caused the heart muscle to slightly increase in size. Our goal now is simply to reduce that workload and give your heart a rest." That kind of picture is much easier to grasp, isn't it? It's less frightening, and it immediately clarifies the goal of the treatment. This phrase also serves as a subtle test of how confident the doctor is in their findings. Someone who truly understands a subject can always explain the basics to a child. If, however, the doctor becomes irritated or avoids the question by using even more complex terminology, that can be a worrying sign. It might mean they aren't entirely certain about the diagnosis themselves. Don't be afraid to keep asking questions until you have a crystal clear picture in your mind. You can use active listening techniques and say, "Doctor, I apologise, but I just want to be certain I've understood. So, put simply, the core problem is X, and that means Y. Is that correct?" This shows your engagement and helps avoid potentially disastrous misunderstandings. Let's take a closer look at the psychological barriers that stop us from asking even the most basic, fundamental questions. Why do our tongues suddenly fail us when we simply want a plain explanation? The main culprit here is what we might call patient imposter syndrome. We feel we have no right to take up the valuable time of a busy professional, assuming our questions will sound naive, or frankly, a bit dim. This fear is deeply rooted in the old, paternalistic model of medicine, where the doctor was the ultimate authority and the patient simply obeyed orders. But times have moved on. The modern healthcare system now advocates for a partnership model where the patient is an equal and essential participant in their treatment journey. To break down this internal barrier, we need a shift in perspective. You are not a beggar asking for charity. You're a service user, a customer, employing an expert to help solve your problem. You have every right to understand what you are paying for and exactly what procedures are being performed on your body. Try using 3 simple strategies to help you speak up. Number 1, preparation. Write your questions down on a piece of paper. When the question is right there in front of you, it's much easier to ask, even if your nerves are acting up. The second technique is depersonalizing the question. Instead of saying, "I don't understand," try phrasing it like this. "Medicine is such a complex field. Could you possibly help someone who isn't medically trained, like myself, understand this particular term?" This removes any perceived blame for not understanding and shifts the focus onto the complexity of the subject itself. The third strategy is appealing to your shared goal. You might say, "Doctor, I genuinely want to follow all your recommendations accurately, and to do that, I need to understand the underlying issue completely. Could you please help me achieve that?" This approach assures the practitioner that your aim is not to challenge their authority, but to maximize the effectiveness of your treatment. Always remember that the consequences of misunderstanding your diagnosis can be catastrophic. Incorrectly gauging the seriousness of the situation can lead to poor adherence to treatment plans, while excessive fear caused by unfamiliar terminology can lead to stress, which itself often worsens many medical conditions. That moment of awkwardness is simply not worth these kinds of risks. It's crucial to understand the difference between a symptom, a syndrome, and a proper diagnosis. Quite often, the root of confusion between a patient and their doctor stems from mixing these three terms up. When you visit your GP, you're usually complaining about symptoms. A symptom is simply the subjective experience of being unwell, what you feel: pain, nausea, general weakness, or a persistent cough. This is your starting point, but it's certainly not the finish line. For instance, a simple headache is just a symptom. Now, a syndrome is a collection of symptoms that reliably appear together and characterize a particular medical state. Take, for example, irritable bowel syndrome, or IBS. That isn't a single disease, it's a whole cluster of issues, including abdominal pain, bloating, and irregular bowel movements. A syndrome offers a clearer picture, granted, but it often just describes the problem without pinning down the specific, underlying cause. Finally, the diagnosis is the identification of the specific illness or condition that lies at the very root of your symptoms or syndrome. It is the crucial step of establishing the primary cause. For instance, your headache, the symptom, could be the result of a migraine, a diagnosis, high blood pressure, another diagnosis, or even cervical spine issues like osteochondrosis, yet another diagnosis. Crucially, the treatment in each of these scenarios will be entirely different. When you ask your doctor for a precise diagnosis, you are essentially asking them to travel the full distance from your initial complaints right back to the root cause. You are encouraging them not to stop halfway, say, by simply prescribing a pill for the symptom, like a painkiller for your headache, but rather to really get to the bottom of the matter. Asking this question also opens up the crucial dialogue about diagnostic investigation. You might ask, "Doctor, are we confident this is the final diagnosis, or is it still a working theory?" Or, "What further tests might be needed to confirm this, rule out other possibilities?" This actively involves you in the process and helps you understand the clinical logic being used. You stop being just a list of symptoms and instead become a partner in the intellectual task of finding the genuine reason for your condition. And that, frankly, changes everything. Let's debunk a widely held and, frankly, rather damaging misconception. The idea that a good doctor will tell you everything you need to know without you having to ask a single question. This delusion stems from that idealized movie image of a doctor, the one who has endless time and is also a brilliant amateur psychologist. The reality is, your doctor is a professional working within a very strict, demanding system. Let's try to look at this situation through their eyes. Firstly, they might genuinely assume you understand everything. Medical terminology is their daily professional language. They live and breathe it. It often doesn't even occur to them that what they've said sounds like a load of unintelligible noise to you. They aren't mind readers, they can't gauge your level of medical literacy. Secondly, they may feel that giving you too much information could actually be harmful. This is the old paternalistic do no harm model, which is sometimes interpreted as do not frighten the patient. A doctor, acting with the very best intentions, might hold back certain details or potential negative outcomes simply to spare your nerves. But ultimately, that prevents you from making a truly informed decision. Thirdly, as we've already touched upon, they simply lack the time. Within that standard 50-minute appointment slot, they have so much to cover that there is no time left for a detailed lecture on the nature of your ailment. They are forced to deliver information in a highly condensed, concentrated format. This is precisely why a proactive approach from you is so essential. You must initiate that in-depth dialogue. Don't sit back and wait for them to present all the information to you on a silver platter. Your job is to become the interviewer, using the right questions to extract the necessary information in a way that you can understand from the expert. The question about your diagnosis and what it truly signifies is the very first and most critical step in this entire process. Think of it as the ignition key that starts the engine of real communication. Without it, you risk remaining stuck in the car park, never managing to get underway. To make your first consultation as productive as possible, you really need to prepare properly beforehand and make sure you record all the information you receive. Turning up to see the doctor unprepared is like setting off on a hike without a map or a compass. There's a good chance you'll just get lost. So, what should you do before your visit? Start by making a detailed list of all your symptoms. Describe as clearly as possible what hurts or worries you, where it is, when it started, and how it affects you. This will help your GP quickly focus on the problem. Jot down all the questions you want to ask, either on paper or in your phone. Crucially, the first question about your diagnosis should be right at the top of that list. During the consultation, don't rely solely on your memory. Stress and anxiety can make you forget half of what the doctor says. Therefore, you must write down the doctor's answers. The simplest method is a notebook and a pen. Note the exact name of the diagnosis and the key points from the doctor's explanation. Please don't hesitate to politely ask the doctor to write down the name of the diagnosis clearly. That is absolutely your right. A more modern and effective approach is to use the voice recorder on your smartphone. However, there is a very important ethical consideration here. You must ask the doctor for permission first. The vast majority of reasonable doctors will not object, provided you clearly explain why you are asking. Simply say, "Doctor, this information is very important, and I'm worried I might miss something or forget it later. Would you be happy for me to record our conversation on my phone so I can listen back to it calmly afterwards?" This recording will become your invaluable archive. Once you're home in a calm environment, you can listen through it again, properly absorb the details, and look up additional information about your diagnosis from reliable sources, such as medical association websites, definitely not just online forums. This process will allow you to prepare thoroughly for your next visit and formulate new, more in-depth questions. Keeping records like this is the sign of a responsible patient, someone who takes their health seriously and respects the doctor's time by aiming to get the maximum benefit from every single appointment. Right, so we've nailed down the diagnosis. You now have that crucial starting point on the map, defining your current health situation. The next logical step, naturally, is figuring out the route forward. And this is where the second key question comes into play. What treatment options are available, including the option of no treatment at all? And what are the pros and cons of each? This question is genuinely revolutionary for a patient. We're often used to thinking there's only one single right path, one gold standard treatment, which the doctor will simply dictate to us. But modern medicine is far more complex and multifaceted than that. For most conditions, especially chronic ones, there are often several alternative approaches. The choice between them frequently depends not just on clinical necessity, but also on your personal circumstances, your values, and your preferences. By asking this question, you move away from the passive role of simply following instructions and step into the active role of a decision maker. This is the foundation of shared decision making, which is now the gold standard in modern healthcare. The essence is straightforward. Your doctor is the expert in medicine, but you are the expert in your life. The doctor provides you with all the necessary information about the various paths, the treatment options, their benefits, and their drawbacks. And you, armed with that information, alongside your own goals, your concerns, your financial situation, and your lifestyle, then make an informed choice. The final decision is reached together. Asking this question signals to your doctor that you're not looking to follow instructions blindly. You want to make a truly informed choice. It prompts the physician to step outside their usual routine and consider your situation individually. Perhaps the standard treatment is highly effective, but it might be incredibly expensive and you're on a limited budget. Or perhaps it requires frequent clinic visits and you live miles away. By discussing all the options together, you can find the path that is not only medically sound, but also truly manageable for you. That is personalised medicine in action. Let's delve a little deeper into what treatment options truly means. It's certainly not always just a choice between one pill or another. The spectrum of possibilities is much broader, and your specific question should prompt your doctor or consultant to lay out the full picture. The first and most obvious option is medication. But even here, there are alternatives. We're talking about different classes of drugs with varying mechanisms of action, differing effectiveness, different side effects, and crucially, varying costs. You might have the original branded medication or their more affordable counterparts, the generics. Discussing these precise nuances is absolutely your right. The second crucial option is lifestyle modification. For an enormous range of conditions, from diabetes and high blood pressure, right through to joint problems and depression, this point is not merely a supplement, but often the very foundation of treatment. This involves necessary dietary adjustments, introducing regular physical exercise, improving sleep hygiene, and learning techniques for stress management. Often, well-planned lifestyle changes can provide effects comparable to medication, or at least allow you to significantly reduce the required dosage of drugs. The third option covers non-medicinal methods. This is a huge category, encompassing physiotherapy, therapeutic exercise, massage, manual therapy, and psychotherapy. For many conditions, especially those related to the musculoskeletal system or psychosomatic issues, these methods can actually be the first line of choice. Fourth, we have surgical intervention. It is vital to understand when an operation is the only viable route and when it is simply one option among many, reserved perhaps for when other methods have proven ineffective. The fifth, and a very important option that we will discuss separately, is the tactic of active monitoring, or what we call watchful waiting. By asking about all these options, you gain a complete overview of the possibilities and can build a comprehensive plan, one that might draw elements from various groups such as taking medication, plus dietary changes, plus a course of physio. That second question we ask contains a detail that might seem a bit provocative, but it is absolutely crucial. The phrase, including refusing treatment. Why on earth would we ask about doing nothing? Aren't we going to the doctor precisely to get treatment? Well, this part of the question serves a vital function. It establishes your crucial baseline. To properly weigh the benefits and risks of any intervention, you must understand the natural course of your condition. What happens if you genuinely choose to do nothing? Will the ailment simply resolve itself? Will it progress slowly but surely? Will it stay exactly the same for years to come, or will it lead to quick and dangerous complications? The answer to that question is the foundation upon which all your subsequent decisions must be built. Let's take a common scenario. Perhaps they find a small nodule on your thyroid gland. Your doctor suggests a biopsy and maybe even surgery. That sounds terrifying. But if you specifically ask about the doing nothing option, you might discover that a huge number of these nodules are benign. They don't grow for years and they pose no real threat to your health. In this case, a strategy of active monitoring, say a regular ultrasound once a year, can be a perfectly reasonable and justified alternative, saving you needless stress and the risks associated with invasive procedures. Or consider this. You are offered an expensive course of treatment for a condition that, as it turns out, is highly likely to clear up completely on its own within a couple of weeks. Knowing this, you might decide to simply tolerate the temporary discomfort, saving money and sparing your body from unnecessary medication. Asking about refusing treatment is not a call to inaction. It is a fundamental call to awareness. It allows you to clearly separate situations where intervention is absolutely life-saving from those where it is simply one option, or perhaps even excessive. This is ultimately the most honest way to truly gauge the value of the treatment being proposed to you. When your consultant starts outlining the benefits of a treatment plan, your job isn't just to passively listen. You need to actively probe and pin them down for concrete details. Vague phrases like, "you'll feel much better," or "this is highly effective medication," aren't helpful. What you really need are facts and, whenever possible, measurable figures. So what clarifying questions will help you get an objective assessment of the pros? The first question: precisely how much improvement should I expect? Ask your doctor to express the expected results in measurable metrics. For instance, by how many points on average will my blood pressure decrease? What percentage reduction in my pain symptoms is realistic? Or, what's the statistical likelihood of achieving full remission? Of course, medicine isn't strictly mathematics, and no doctor can offer a 100% guarantee. But they can certainly rely on data from clinical studies and statistics. The second question: how quickly should I expect to feel the effect? This is vital for managing your expectations. Some medications work almost immediately, while others require weeks or even months before you notice a change. Knowing this timeline prevents disappointment and stops you from prematurely abandoning a treatment if you haven't seen an instant result. The third question: how long is this effect expected to last? Is this treatment aimed at temporary symptom relief or a long-term solution to the problem? Crucially, will I need to take this drug for the rest of my life? The answer to this defines your overall treatment strategy. The fourth and very crucial question is, what is the core purpose of this treatment? Are we aiming for a full cure, or is the goal the control and management of a chronic condition? Or, in an incurable situation, is it simply palliation, the relief of suffering? An honest understanding of the therapeutic goal helps you set the right priorities. By getting clear answers to these key questions, you can form a precise, objective picture of exactly what you can realistically expect from choosing any specific treatment path. Talking through the potential drawbacks is perhaps the most crucial part of any discussion with your doctor, because these are the difficulties you might actually have to live with. This isn't just about the side effects listed on the treatment leaflet. The definition of drawbacks is much broader, covering every aspect that could negatively impact your daily life. So what exactly are the downsides we need to address? Firstly, of course, there are the side effects and the general risks involved. Don't just ask if there are any. You need to pin down the details. Ask specifically, how common is this particular side effect? How severe does it usually get? Is it reversible? Meaning, will it disappear once I stop taking the medication? Which side effects are serious enough to require immediate medical attention? Secondly, let's talk about the financial cost. Please do not hesitate to ask direct questions about the money involved. What is the cost of this drug or the full course of procedures? Is any of this covered by my insurance? Are there cheaper, yet equally effective alternatives available? The financial burden of treatment is a very real concern, and it might mean you simply cannot afford the recommended course. Being honest about the cost implications early on will help you and your doctor find an option that is manageable for your budget. Thirdly, consider the impact on your general lifestyle. Ask, will this treatment require any specific restrictions? Will I still be able to drive, work, or exercise? How often will I need to visit the clinic, and how much time will those visits take up? For instance, some medications cause drowsiness, which is critical if you are driving, while a course of chemotherapy might take you out of your routine for months. Only by weighing up all three of these components, the health risks, the financial burden, and the inconvenience to your daily life, can you properly assess the true price of each treatment option and compare it realistically against the potential benefits. Let's look at how applying this second question works in a real-life scenario. Imagine a 60-year-old woman let's call her Mrs. Evans, who has been diagnosed with knee osteoarthritis, or simply wear and tear in the knee joint. She's in pain and finding it increasingly difficult to walk. Her orthopedic consultant or specialist offers the standard solution. Here is a prescription for NSAIDs, non-steroidal, anti-inflammatory drugs, to manage the pain. Come back in 6 months. If things get worse, we'll start thinking about a joint replacement operation. Mrs. Evans, understandably scared by the prospect of major surgery, could have simply left. But instead she asks our crucial second question. Doctor, what are the other options available besides just pills and an operation? This opens up a far more interesting dialogue. The doctor, seeing her engagement and desire for information, details the choices. Option 1. NSAIDs. Pros. They quickly relieve pain. Cons. They can cause stomach issues. They don't treat the underlying cause, and the effect is only temporary. Option 2. Intra-articular injections of hyaluronic acid. Pros. They essentially lubricate the joint, reducing pain, and the effect can last for several months. Cons. They can be quite expensive, the procedure requires precision, and there is a small risk of infection. Option 3. A combination of physical therapy and targeted exercises. Pros. This strengthens the muscles around the joint, which reduces overall stress, improves circulation, and delivers a stable long-term effect. Cons. It requires regular effort and time investment from the patient, and the results are not immediate. Option 4. Weight reduction. Pros. Every kilogram lost reduces the pressure on the knee joint by 4 kilograms. This is often the most powerful factor in long-term treatment. Cons. It requires significant motivation and changes to long-established dietary habits. Option 5. Surgery. Pros. It's the ultimate, definitive solution to the problem and provides complete relief from chronic pain. Cons. It is major surgery, carrying serious risks such as anesthesia complications, thrombosis, or infection, plus a long, dedicated rehabilitation period. Now, Mrs. Evans has a complete roadmap. She understands she can start with the safest and most beneficial steps: weight loss and physical therapy. She can consider injections as a potential next step if those don't suffice. The pills can be reserved purely for managing acute flare-ups of pain. And surgery? That is now the absolute last resort. She leaves the appointment not just with a single prescription, but with a comprehensive, multi-tiered strategy for managing her condition. Right then, you've discussed all the options, weighed up the pros and cons, and together with your doctor, you've settled on a specific treatment strategy. It seems like you're ready to begin. But there is one final, crucial piece of information we need to clarify, and that brings us to the third question. What will happen if I choose this course of treatment? What results and side effects should I realistically expect? If the second question was about choosing the path, this one is about what lies ahead on that journey. It helps paint a realistic picture of the future and allows you to prepare mentally for it. This is incredibly important for your peace of mind. The main source of stress and anxiety is uncertainty. When you don't know what to expect, even small changes can trigger panic. Asking this question transforms the unknown into a set of anticipated events. It helps you form realistic expectations. For example, if your doctor honestly warns you that when starting antidepressants, your anxiety might actually increase for the first 2 weeks, and that this is a normal phase before improvement sets in, you won't panic and stop treatment prematurely. You will simply know it is part of the process. Similarly, if the surgeon tells you that after a hernia operation, the pain in your leg will ease straight away, but the numbness might linger for several months, you won't despair when you feel that persistent tingling. This question is your essential guide, your navigator. It helps you distinguish between the normal course of recovery and potential complications. You'll understand which symptoms are anticipated side effects and which are genuine red flags that require immediate attention. Essentially, you are asking your doctor to provide an owner's manual for your body during the treatment period. This provides a powerful sense of control and significantly lowers your stress levels, which in itself is a vital part of the healing process. Let's properly unpack the first half of that third question. What results should I expect? The crucial task here is taking those general aspirations and turning them into specific, measurable, time-bound indicators. This is what they call SMART goal setting in management: specific, measurable, achievable, relevant, and time-bound. It's a wonderfully useful framework. Ask your doctor quite plainly, how exactly will we know this treatment is working? The answer needs to be absolutely unambiguous. If we're talking about treating anemia, the goal isn't just raising hemoglobin. It should be defined as reaching a hemoglobin level of 120 grams per litre within 2 months of starting the iron supplements. If it's rehabilitation after a stroke, it shouldn't just be recovering movement. It should be, in 1 month, the patient should be able to sit up in bed unassisted, and within 3 months, they should be walking with the aid of a cane or stick. Why is this so vital? Firstly, it gives you a very clear compass point and motivation. You know precisely what you are aiming for. Secondly, it allows you to objectively gauge the effectiveness of the chosen strategy. If, after the agreed time has passed, those specific benchmarks haven't been met, it's a clear indication, for both you and the doctor, that the plan needs an urgent review. Perhaps changing the medication, increasing the dosage, or bringing in alternative therapies. Without these clear success criteria, your treatment can quickly turn into an aimless, unending process with an entirely unpredictable outcome. You might spend years swallowing pills, never truly knowing if they are helping you at all. Crucially, always clarify the time constraints. Ask, when should I expect to feel the first, most minimal improvement? And when can we realistically anticipate reaching the maximum effect? The answers to these questions create a clear timeline for you, helping you maintain patience and stop you from expecting instant miracles where they simply aren't possible. It transforms your treatment from chaotic wandering into a purposeful journey along a defined roadmap, complete with clearly signposted checkpoints. Now, we move on to the second, and often most worrying part of the conversation. What side effects should I actually expect? Having a good chat about the side effects is the real litmus test for the openness and honesty of your relationship with your GP or specialist. Many patients are apprehensive about bringing this up, and some doctors can be a bit reluctant to initiate the discussion. But glossing over this topic is a surefire way to run into a spot of bother down the line. Your aim isn't just to get a formal list of every potential horror story from the patient information leaflet, but rather to walk away with a practical, sensible guide on what to actually do. To ensure this conversation is as constructive as possible, here are the key clarifying questions you should put to your doctor. First, Doctor, I can see this rather long list in the leaflet. Realistically, which of these effects do you see frequently in practice, and which are genuinely rare occurrences? This distinction helps separate the genuine, practical risks from the theoretical ones. The chance of suffering a side effect that affects only 1 person in 10,000 is negligible, and certainly not something you should lose sleep over. Second, and most crucial, which side effects are simply unpleasant but manageable, and which are the dangerous red flags that mean I must immediately stop taking the medication and contact you, or even call for an ambulance? You need to leave the surgery with absolute clarity on what signs to watch out for. For example, mild nausea for the first couple of days might be a bit bothersome but not alarming. However, sudden shortness of breath, a severe rash, or developing jaundice, the yellowing of the skin, is definitely a major cause for concern. Third, are there any simple ways I can lessen the risk or the severity of these side effects? Sometimes the solution is incredibly simple. Perhaps taking the medication strictly after a meal, washing it down with plenty of water, avoiding certain foods, or only taking the tablet just before bed if it causes drowsiness. Having an open and detailed discussion about side effects isn't about scaring you, it's about giving you a proper safety briefing. Knowing about potential problems makes you far better prepared, enabling you to react in time and hopefully avoid any serious consequences. Let's address another very common and potentially dangerous myth regarding side effects. The idea that, if my doctor prescribed it, it must be completely safe for me. This is a serious misconception. When your GP or specialist prescribes a drug, they rely on data from massive clinical trials where the medicine was tested on thousands of people. But you are not the average research participant. You are a unique individual with your own genetic makeup, pre-existing conditions, lifestyle habits, and, crucially, a list of other medicines and supplements you are already taking. The safety of any new medication specifically for you depends on countless factors, many of which only you know. Therefore, it is your responsibility, both to your doctor and to yourself, to provide the fullest possible picture. Before a doctor issues a new prescription, you must inform them about absolutely everything you consume. This includes all prescription drugs given by other specialists, such as your cardiologist or endocrinologist, all over-the-counter remedies you use occasionally, painkillers, fever reducers, allergy relief, or sleeping aids. And finally, all vitamins, minerals, supplements, and herbal preparations. Many people make the huge mistake of not considering supplements and herbs to be real medicine. This is a mistake. For example, the seemingly harmless herb St. John's wort is a potent inducer of liver enzymes and can significantly weaken the effect of many vital medications, including blood thinners. Even grapefruit juice can dangerously intensify the effects of statins, which are drugs used to lower cholesterol. Drug interaction is an extremely complex area of pharmacology, and without complete information from you, your doctor cannot possibly assess all the risks. Your safety is a shared responsibility. Please be completely honest and open. How does this crucial third question change you from a passive recipient of treatment into someone who actively manages it? Essentially, it gives you the tools for self-monitoring and providing essential feedback. When you know exactly what results to expect, the time frame for those results, and which side effects to watch out for, you instantly become the chief controller of your own treatment process. You start monitoring your body consciously. Think of it like a scientist in a lab. Your body is the subject of the research, the treatment is the experiment, and you are the careful lab technician, noting down every single change. Imagine your doctor prescribes a new blood pressure medication and tells you, your goal is to bring your morning blood pressure down to 135 over the next month. A potential side effect might be a persistent dry cough. If that cough is seriously keeping you awake, please give me a call. What do? You start keeping a detailed blood pressure diary. Every morning and every evening, you measure your blood pressure and pulse, and you jot those numbers down. At the same time, you're listening to your body. Has that cough shown up yet? A month later, you go back for your follow-up appointment, but instead of saying vaguely, "Oh, I think I feel a bit better," you show up armed with concrete data. You hand the diary to your GP and say, "Doctor, look, over the last month my average morning reading has dropped from 160 to 140. We haven't quite hit the target yet. And yes, I have developed a cough. It's been bothering me for a week and making it hard to sleep." This information is invaluable to your doctor. It allows them to objectively assess the situation. They can see the medication is working, but perhaps not effectively enough, and it's also causing that bothersome side effect. Based on your precise records, they can make an informed decision, perhaps increasing the dose of this drug, adding a second one, or switching to something completely different. By providing this targeted feedback, you have directly influenced the correction of your treatment, making it far more accurate and safer for you. Let's reinforce the importance of that third question with another practical example. Imagine two patients, let's call them Victor and Simon. Both were prescribed the exact same course of antibiotics to treat a bacterial infection. Victor, the typical patient, simply took the prescription and left. Simon, however, asked the third question, and here is the advice he received from his doctor. This medication is highly effective, but roughly 10% of patients may experience diarrhea. If it's just a mild stomach upset, don't worry. Keep taking the medication and ensure you drink plenty of fluids. However, if your bowel movements become very frequent, watery, or if you notice any traces of blood, that is a red flag, a sign of a dangerous complication. In that event, stop taking the medication immediately and phone me. 3 days pass. Both Victor and Simon develop diarrhea. Victor, having no prior warning, starts to panic. He assumes he's contracted some terrible new illness. He begins self-medicating, taking anti-diarrhea tablets, which in this specific scenario only make things worse. His condition rapidly deteriorates. Simon, when faced with the diarrhea, initially doesn't worry. He was warned after all. He simply keeps an eye on it. But the following day, he notices his bowel movements have become very frequent, and there is blood present. He immediately recalls the doctor's warning about the red flag. He stops the antibiotic instantly and calls his doctor. The doctor brings him in, confirms the complication, and switches him to the correct alternative treatment. Simon recovers quickly. Victor, however, due to his ignorance and incorrect actions, ends up being hospitalized. This story clearly illustrates how knowledge, gained simply by asking one straightforward question, can not only save you a great deal of stress, but genuinely protect you from severe complications. Forewarned is forearmed, and in medicine, that rule applies 100%. Right then, we've settled on the diagnosis, and the treatment plan is sorted. Now it's high time we tackle the question that genuinely shifts the spotlight of responsibility, moving it from the doctor squarely onto your own shoulders. This is the fourth, and frankly, incredibly powerful question. What can I do myself to genuinely improve my condition? That question is the true hallmark of an engaged, informed patient. It instantly changes the whole dynamic in the consulting room. By asking it, you send the doctor a crucial signal. Doctor, I'm certainly not expecting some miraculous silver bullet from you that will fix everything overnight. I fully grasp that my health is primarily my responsibility. I'm ready to put the work in, to change my habits and make the necessary effort. Please, just be my coach and guide me along this journey. Believe me, for most doctors, bless their hearts, who are exhausted by passive patients who ignore advice and rely solely on medication, this kind of proactive approach is like a breath of fresh air, a real tonic. The doctor sees you not just as another patient, but as a motivated partner, and their willingness to help, share knowledge, and dedicate more time to you increases tenfold. This single question opens the door to the biggest and most vital area of all, the world of managing your health through lifestyle. What you do outside the surgery, during those remaining 23 hours and 50 minutes of the day, how you eat, how you move, how you sleep, and how you handle stress, that has a far greater and longer-lasting impact on your well-being than any medication, no matter how modern. Essentially, you are asking the doctor to write you one more critical prescription, a lifestyle prescription tailored precisely to your specific condition. This is the critical transition from the passive model of I am being treated to the active model of I am taking charge of my recovery. And that shift in mindset is the absolute key to gaining real, not just illusory control over your own health. When you ask yourself, what can I do to help myself? The crucial thing is not to settle for vague, general advice. Tips like eat better, move more, and avoid stress are practically useless. Why? Because they never actually tell you how to do it. Your job is to use targeted, probing questions to turn those abstract slogans into specific, personalized, and genuinely achievable instructions. If your doctor mentions diet, dig deeper. Ask, which foods should I absolutely cut out first? What should I be adding to my meals instead? Are there specific eating patterns I should follow? For instance, eating smaller, more frequent portions. Do I need to count calories, or is focusing on food quality more important? Could you suggest a specific regime, like the Mediterranean diet? When discussing physical activity, get specific details. Ask, given my current condition, what is the safest and most beneficial activity for me? Walking, swimming, or maybe yoga? How many days a week should I exercise, and for how long? What level of intensity is appropriate? Should I monitor my heart rate? Are there any specific exercises that I must completely avoid? If the advice is about stress, inquire, which specific relaxation techniques do you recommend for my situation? Breathing exercises or meditation? Would it be helpful for me to consult a psychologist or therapist? The more detailed your questions are, the more practical and useful the answers will be. Your goal is to leave that appointment not just with general ideas, but with a clear step-by-step action plan for lifestyle changes, one you can start putting into practice immediately. Let's delve into this. How does that fourth question fundamentally alter the way you interact with your GP or specialist? Think about your doctor's average day. It's a relentless stream of appointments. Sadly, many patients exhibit what's often called learned helplessness. They essentially shift all responsibility for their health onto the medic, expecting them to work a miracle. They might ignore dietary advice, skip their medication, and then return complaining. Doctor, your treatment simply isn't working. This is a fast track to professional burnout and cynicism. The doctor starts to feel that their efforts are entirely pointless, and then suddenly you break that cycle. You burst into that flow and ask the question that completely shatters that old pattern. What can I do myself? For the doctor, this question is like music to their ears. It signals several crucial things. Firstly, it signals trust. You trust their expertise, not just in handing out prescriptions, but in the broader context of a healthy lifestyle. You see them not merely as a repairman for a broken part, but as a genuine health expert. Secondly, it highlights your motivation. You are showing a willingness to put in the effort. This means their advice won't just be ignored or go unheard. For any professional, there is no greater joy than working with a motivated patient, because that's the kind of work that yields visible results and brings true professional satisfaction. Thirdly, it's about respect. You respect their knowledge and, crucially, your own well-being. You view your treatment not as an annoying necessity, but as an important project you're personally invested in. In response to this attitude, the doctor is far more likely to step outside the formal protocol. They will dedicate more time to you, offer highly personalized recommendations, and perhaps even share some professional insider tips they wouldn't normally disclose to everyone. You cease being just diagnosis in room 5 and become an actual person, a partner they are working with side by side to achieve a shared goal, your health. That ultimately is the foundation of a true therapeutic relationship. The question, what can I do for myself, is also an excellent way to safely and properly discuss what are known as complementary or alternative therapies. Many patients are interested in things like herbal remedies, homeopathy, acupuncture, or osteopathy, but they often feel nervous bringing them up with their doctor, fearing ridicule or disapproval. As a result, they start using these methods in secret, and this can be quite risky, as some alternatives may clash or be incompatible with the main treatment you've been prescribed. Your question gives you a constructive way to raise this topic. For example, you could ask, Doctor, I've read that some people with my condition find acupuncture helpful. What are your thoughts on that? Could it be a useful addition to my main therapy in my case? Or perhaps, someone suggested I try this herbal supplement. Is it safe to take alongside the medicines you've prescribed me? This phrasing doesn't pit the alternative method against the primary treatment. Rather, it frames it as a potential supplement. This allows your doctor to step out of a defensive role and into an expert advisory position. A good, modern GP won't simply reject everything that isn't a pill or a scalpel. They can help you separate methods that have some genuine evidence and potential benefit from those that are blatant quackery. Crucially, they can properly assess the risks involved. For instance, they might say, yes, some reliable studies show that omega-3 fatty acids could be helpful for easing joint inflammation, so you're welcome to try those. But I would advise you to steer clear of that particular herbal tea, as it could conflict with your blood pressure medication. In this way, you receive qualified, professional advice, allowing you to safely integrate beneficial additional methods into your overall treatment plan while avoiding anything that could cause harm. That truly is a sensible, integrated approach to your health and well-being. It's high time we completely debunked one of the most paralyzing myths that stops people from truly taking charge of their health. That myth is this: there's nothing I can do. Everything is predetermined by my genes, the environment, and age. While this fatalistic viewpoint is certainly convenient because it absolves you of all responsibility, it is, quite frankly, utter nonsense. Modern science, and specifically the fascinating field of epigenetics, has provided irrefutable evidence that our lifestyle is a tremendously powerful factor capable of controlling how our genes actually express themselves. Having bad genes isn't a death sentence. It's simply a predisposition, a risk factor. Whether that risk ever manifests or not depends largely on you. Let's look at some specific, scientifically proven examples. Take cardiovascular disease. Even if you have the most unfavourable genetic background, regular physical activity, quitting smoking, and a diet rich in vegetables and healthy fats can reduce the risk of a heart attack or stroke by tenfold. Your daily habits, quite simply, outweigh your genes. For oncological conditions, the World Health Organization estimates that between 30 and 50% of all cancer cases could be prevented through a healthy lifestyle, primarily by avoiding tobacco, eating well, staying active, and maintaining a healthy weight. Type 2 diabetes is a classic example of what we call a lifestyle disease. In 90% of cases, it can either be prevented entirely or managed into strong remission simply by adjusting diet and increasing mobility. Even the process of aging itself can be influenced. Studies show that regular physical and mental exercise can significantly slow down age-related cognitive decline and dramatically reduce the risk of developing dementia. Your question, what can I do myself, is a direct challenge to this myth of helplessness. It's a statement that you refuse to be a passive victim of circumstances and genes. Instead, you intend to become the active architect of your own health, and the science is completely on your side. Right, following on from your last point, the doctor has shared some excellent recommendations for adjusting your lifestyle. The crucial thing now is making sure those recommendations don't just stay as good intentions, but actually become real, tangible changes. The key to success here is introducing self-monitoring. What is that? Simply put, it's the routine process of tracking and recording specific health and lifestyle metrics. It's a hugely powerful tool that achieves three vital things. It heightens your awareness, provides essential motivation, and gives you and your GP objective data. What exactly should you be tracking? Well, that depends entirely on your specific condition and goals. If your goal is managing high blood pressure, start keeping a dedicated blood pressure diary. If you're living with diabetes, you must log your blood glucose levels, but also keep a very detailed record of everything you consume. If you suffer from frequent migraine attacks, a dedicated headache diary can help pinpoint those triggering factors. And if you're trying to lose weight, simply stepping on the scale isn't enough. You need to track not only your weight, but also your body measurements, your daily steps, and the calorie count of your diet. Fortunately, there are plenty of convenient tools available today, ranging from a simple paper notepad to the hundreds of tracking apps available on your smartphone. Why is this necessary? Firstly, it brings vital awareness to your actions. When you know you'll have to record everything you've eaten later that evening, you are much more likely to hesitate before reaching for that extra slice of cake. Secondly, it provides visible feedback and major motivation. Seeing your weight trend downwards or your blood pressure stabilize on a chart really gives you the encouragement you need to keep going. Thirdly, and crucially, you arrive at your next doctor's appointment not empty-handed, but equipped with incredibly valuable information. You can show your diary to your GP and say, "Look, as soon as I started hitting 10,000 steps a day, my fasting sugar levels dropped by this amount." This objective data allows your doctor to accurately judge the effectiveness of their current recommendations and adjust your treatment plan if necessary. You essentially become an active partner and researcher in managing your own health. This brings us to the fifth and final crucial question. Its purpose is to really tie up the consultation, structure everything we've discussed, and establish a clear path forward. Once the discussion is complete, you absolutely must ask this critical question: what exactly is the plan going forward? And when should my next appointment be? This single question is your best defense against uncertainty and anxiety. Far too often, appointments finish with that frustratingly vague statement, "Well, just keep taking the medicine, and if things get worse, come back." That sort of non-committal phrasing leaves you completely in limbo. What if it doesn't get worse but doesn't improve either? How long is a reasonable time to expect to see some improvement? And when exactly do I need to get those follow-up tests done? Without a definite plan, you are left wrestling with your own fears and doubts. Insisting on a proper plan compels the doctor to establish a clear, documented roadmap for your treatment. This immediately gives you a sense of control and the reassuring feeling that you haven't simply been left to fend for yourself. A truly effective plan should always contain several non-negotiable elements. Firstly, specific aims and targets set for a defined period, say, the next 4 weeks. Secondly, a clear list of your responsibilities, such as your medication schedule, necessary dietary changes, and any specific exercises. Thirdly, defined checkpoints, the precise date of your next review, and deadlines for any necessary blood tests or diagnostic scans. Fourthly, instructions for any unexpected issues, those crucial red flags that indicate you must seek immediate attention without waiting for your routine appointment. Having this structured plan transforms your treatment from a chaotic guessing game into a well-managed project. You know exactly what steps you need to take, what the doctor's responsibilities are, and how you will jointly measure success. This lifts a huge weight of worry, allowing you to move calmly and methodically toward your ultimate goal, full recovery or effective management of your condition. This is the final, essential element that ensures the entire consultation feels complete and truly productive. Let's take a closer look at the key components, the building blocks, if you like, of that reliable and clear action plan you should be asking your doctor for. Simply jotting down the date of your next appointment just won't cut it. A proper plan is a multi-layered structure. The first and most important element is the checkpoints. These aren't just dates, they are milestones on your journey. This might involve a follow-up blood panel, a monitoring scan, a visit to a specialist, or just a routine consultation with your treating physician. For every one of these checkpoints, you need the answer to 2 key questions: when and why. For instance, in 1 month, we need a biochemical blood test. It's crucial for us to see how this medication is affecting your kidney function. The second element is the criteria for measuring effectiveness. How exactly will both you and your doctor know that you are moving in the right direction? These criteria must be as specific and measurable as possible. For example, at your next visit in 3 months, we expect your glycated hemoglobin level to drop from 8 to 7.5%, and your weight should be reduced by 3 kilograms. The third and crucially important element is the description of red flags or warning symptoms. This is a clear set of instructions defining when you must not wait for your planned appointment, but instead need to contact your doctor immediately or call for emergency help. For instance, if you develop severe muscle pain while taking this drug, stop taking it immediately and call me straight away. The fourth element is a detailed breakdown of your own actions. What exactly, how often, and at what time you need to do things, taking medication, performing exercises, or keeping a self-monitoring diary. A good plan should be like assembly instructions for a complicated machine. It leaves no room for ambiguity or guesswork. It should be so clear that you could easily explain it to another person. We really need to pay special attention to booking your next appointment immediately. Why is it so crucial to nail down that date right at the end of your current consultation, instead of putting it off with that common phrase, "Just give us a ring and book in later"? Well, it really boils down to simple human psychology and behavioural economics. When you have a specific date and time written firmly in your diary or calendar, it creates a solid commitment. The chances of you skipping the visit or letting it slide indefinitely drop dramatically. This is particularly vital when managing long-term conditions, where keeping up regular checkups is absolutely key to success. If booking that next meeting is left entirely up to you without a firm deadline, procrastination creeps in, everyday worries distract you, and sometimes there's even that little dread of hearing potentially bad news. What happens is many patients delay that visit until they feel significantly worse. But the whole point of planned regular observation isn't to react to things getting bad, it's to stop them getting bad in the first place. By spotting any worrying trends early and adjusting your medication or care plan straight away. Regular appointments build that essential rhythm and structure into your ongoing care. What's more, a pre-booked appointment acts as a safety net for your peace of mind. You know that in a month or two, you have that legitimate chance to ask all those nagging questions, discuss any worries, and get reassurance. That significantly reduces anxiety during the time between consultations. So, at the end of your next consultation, make a point of asking the doctor or nurse to book your follow-up right there and then. If they can't do it in the consulting room, step out and head straight to the surgery reception desk. Do not put off this single step. A fixed date for your next meeting isn't just a bit of administrative paperwork, it's the crucial anchor that keeps your ship of health firmly on course, preventing it from drifting off track when life's little storms hit. If the treatment plan your doctor has put together includes any referrals for additional tests or specialist appointments, please don't just accept these pieces of paper without question. You have every right to understand the purpose and the reason behind every single step you are asked to take. Simply attending appointments passively, without grasping the full clinical picture, is just a waste of time, money, and unnecessary worry. For every single test you are asked to undergo, be it a simple blood test, an MRI scan, or an ultrasound, make sure you ask 3 simple questions. 1. What exactly are we looking to confirm or rule out with this investigation? 2. How urgently does this need to be done? And 3. How will the results impact our ongoing treatment plan? The answers to these questions will turn what seems like an abstract procedure into a truly meaningful step. You will then understand that, for example, that unpleasant procedure, the gastroscopy, isn't being done for no reason. It's being done specifically to rule out a stomach ulcer, which will dictate the choice between 2 completely different types of medication. This understanding boosts your motivation and ensures you stick to the diagnostic plan. You should take the same approach when dealing with referrals to specialists. If your GP refers you to a neurologist, ask, "Doctor, what specifically about my condition concerns you? What exact question are you hoping the neurologist can help us answer? And should I take the results of any specific prior tests with me?" This means you arrive at the specialist's office prepared with a clear focus. You can start the conversation by saying, "My GP referred me to you to rule out this particular issue." This saves time and makes the consultation far more efficient and targeted. Understanding the goal of each step is what distinguishes the informed patient from someone who simply follows instructions. The 5th question, the one about your action plan, actually serves another crucial, though often overlooked purpose. It acts as a final summary mechanism and a vital check on your understanding. By asking it at the end of the appointment, you're essentially requesting the doctor to recap all the key takeaways from your conversation, briefly and clearly structured. This really helps to organise all that information in your mind. But there is an even more powerful technique for ensuring absolute mutual understanding. Once the doctor has laid out the plan, you need to take the initiative and use the so-called feedback or teach-back technique. This is considered the gold standard of medical communication. You simply say to the doctor, "Thank you, doctor. I think I've got it all straight. But if you don't mind, let me just repeat it back in my own words, just to make absolutely sure I haven't mixed anything up. And please feel free to correct me if I go wrong." Then you start to run through the points. Right then. So my main diagnosis is this condition, which means that the plan is as follows. I start taking this medication on this specific schedule. At the same time, I'll be doing these particular exercises. I need to keep an eye on this specific indicator and keep a diary. If I develop this particular symptom, I must phone you straight away, and I'll come back for my next appointment on this date with the results of these tests. Have I understood all that correctly? This deceptively simple technique works absolute wonders. Firstly, it helps you memorize and structure the information better yourself. Secondly, it instantly pinpoints any gaps or inaccuracies in your understanding. The doctor will immediately see if you've mixed up the dosage, misunderstood which symptom to look out for, or forgotten about an essential follow-up test. They can correct you right then and there. This final check is your guarantee that you won't leave the surgery feeling utterly confused, but instead with a crystal clear, coordinated, and mutually understood action plan. Let's take one final concrete example to really highlight the power of asking the right questions, specifically the fifth question, and having a crystal clear action plan. Imagine two patients, both leaving the cardiologist's office having just received the same diagnosis, coronary heart disease. Patient 1, let's call him Igor, didn't ask those vital clarifying questions. The doctor, perhaps rushed, scribbled a few prescriptions and simply said, "Stick to a diet, move more and take your GTN spray if you get chest pain." Igor walks out utterly bewildered. What exactly does "stick to a diet" mean? How much more exercise is enough? What if the nitroglycerin doesn't work? When should he book his next appointment? He's frightened and has no idea how to manage this new reality. He will likely live in constant fear, anxious about every little twinge in his chest. Now consider patient 2, Alexei. He asked the fifth question, and crucially, used the teach-back technique to ensure he understood everything. He leaves the surgery with a fully detailed operational plan. My goal for the next 6 months is to stabilise my condition and actively prevent a heart attack. To achieve this, I will take daily aspirin to thin my blood, a statin to manage cholesterol, and a beta blocker to keep my pulse steady. My diet is Mediterranean, strictly limiting animal fats and salt. My exercise routine is a 40-minute brisk walk, 5 times a week, ensuring my heart rate stays below 120 beats per minute. My red flag is chest pain while resting that doesn't subside within 5 minutes of taking my GTN spray. If that happens, I call emergency services immediately. In 1 month, I'll have a blood test for cholesterol, and in 3 months, I will return for a follow-up consultation with the results and my blood pressure diary. Can you feel the difference? Alexei isn't panicked. He has a precise step-by-step roadmap for managing his condition. He understands his objectives, his tools, and his safety protocols. He is not a victim of his illness. He is a knowledgeable self-manager, overseeing a crucial project, saving his own life, with the guidance of an expert consultant, his doctor. His chances of success in this critical project are undeniably far higher than those of the confused and anxious Igor. So that brings us to the end of our discussion on the 5 keys to effective communication with your doctor. Let's quickly recap those essential questions once more. Number 1, what exactly is my diagnosis? And what does that actually mean in plain English? Number 2, what are all my treatment options? including the option of no treatment at all, and what are the pros and cons of each. Number 3, what results should I genuinely expect from this treatment, both the positive outcomes and any potential side effects? Number 4, what practical steps can I take myself to improve my condition and my overall health? And number 5, what is our agreed next step, and when should I schedule my follow-up appointment? Now, these questions are much more than just a checklist. They represent an entirely new philosophy, a philosophy of partnership, awareness, and taking personal responsibility. They transform you from a passive recipient of medical procedures into the captain of your own health journey, with your doctor serving as your trusted navigator and pilot. Please stop being afraid, stop staying silent. Your health is your most precious asset, and you have every right to be an active, fully informed participant in preserving it. Start putting these questions into practice, and you will quickly see a real improvement in the quality of the medical care you receive. Thank you so much for watching this video all the way through. I appreciate that we covered a lot of information, but this knowledge truly can change your life for the better. If you found this video helpful, please give us a like and subscribe to our channel so you don't miss any of our future essential discussions. And finally, I have one key question for you. Which of these 5 questions do you personally find the most difficult to ask your doctor, and why? Please share your thoughts in the comments below, and let's discuss this together.